All right, so picking up where we left off, if you look at this rhythm, one thing that should stand out even without the small boxes is, we'll start at the beginning, right? We see a QRS, right? A T wave that looks inverted, and that's not necessarily a problem. It depends on maybe the lead we're looking at or something like that. And then we see, look, a P wave so super close to that T wave, right? And then look at this big old space between the P wave and the QRS. This is a heart block, right? Which obviously is what we're going to be talking about. The big thing that's happening is there's a disconnect between the P wave and the QRS. The way I like to think about it is take the name. So it's a heart block, right? Well, I imagine there's a block of wood between like the SA node and the AV node. That's kind of how I imagine it, because wood is a really bad conductor of electricity. So it's almost like there's like a piece of wood, there's like a block or something that's in between them, so that it's still going through, but it's just not doing a great job, and it takes a little bit longer. It's like there's something in the way. There's a road, or if you want to think of it like there's a roadblock, right? There's a traffic jam. So the signal takes a little bit longer. So we have the P wave, the atria beat, the atria beat happens, but then it takes too long for the QRS to fire. So again, there's different types of heart blocks. So what I just said about, it's between like the SA and the AV node, that's not always the case. The blocks can be in different places, but most are atrioventricular blocks, or what we call AV blocks. So there's other types, but again, most are what we call AV blocks, meaning that they happen at the conduction point of like the atrioventricular node. So there are also different types, and we classify them by degree. So there's like first degree, second degree, third degree. The way to think about that is the higher the degree, the more of a block there is between those signals. And I'm going to show you examples on the next slide. So the electrical signal, as it's coming in, it's weaker, or it's slowed down from the atria to the ventricle. Usually this means at the PR interval. So the distance between the end of the P wave and the beginning of the QRS complex is elongated. It's too long. In some cases, the P waves can actually become desynced from the QRS complexes. That's in the worst heart blocks, meaning that instead of just seeing the space between the P wave and the QRS get wider, you start having multiple P waves occurring before a QRS happens. And it might sound like I'm describing atrial flutter with that, right? Like with this last bit, but I'm going to explain kind of what that can look like in a second. So this is just a real quick rundown. Thank you, Life in the Fast Lane, I guess, whoever you are, for making this. um, so again, first degree, PR interval, right? So the difference between the start of the P and the R wave, it's longer. It's longer than it should be. In second degree, they can slowly start to drift apart, right? Such that, and then come back together. So like as an example, um, QRS, T wave, P wave, QRS, T wave, P wave, QRS, T wave, P wave. And then see how it kind of like stops, and it's like P wave, QRS. It's kind of following a pattern, but occasionally it's falling out of that. Here you can see another example. This is like it starts and then stops. It says, like over here, it says that they're on, they're off, they're on, they're off. Meaning that sometimes they're synced up, like here, it's happening. They're having P wave, QRS, T wave, and this looks normal. Like the PR interval here looks normal. But here we're having P waves that don't have corresponding QRSs, and then it takes another P wave before they have one, right? And then in the worst cases, you can see here, these P waves are not lining up at all. So in this case, the P wave happens, nothing. We have a P wave, QRS. P wave happens immediately after this. You can see like the space between this QRS and this P wave is shorter than this first one we saw. Here's the QRS, here's the P wave, right? So if you follow like the spacing of the P waves and like how they orient to QRSs is just totally disconnected. And so that's really bad. So in the higher the degree, the more deadly or dangerous these rhythms can get, right? First degree AV block usually is not something that's usually not a concern. So usually like the lower degrees, like first, second degree, they might not even require treatment. They're just not really, in most cases, they're not life threatening. They might be a little uncomfortable depending on how the patient experiences them. They're not ideal, and so we might try to fix them, but they're not necessarily a problem. If there is a need to try to change them, oftentimes it's a case of, all right, try to make lifestyle changes. So like, what's your diet like? Maybe eat better. Are you exercising? Maybe exercise, or exercising too much. Maybe exercise a little bit less, or reduce stress, get more sleep. A lot of those same changes that are true for most patients with cardiac issues might also be caused by medication. So if the patient has a history of heart failure, cardiac arrhythmias, or something like that, they're taking medications for, sometimes this can be a side effect, or it can be exacerbated by some of those medications, right? So changing medications in the worst degrees, so in third degree, or if the patient's symptomatic, or if they have a severe bradycardia with other degrees. Because if they're bradycardic, that means again their heart's not beating as well as it should. Plus, then with the it's not beating as often as it should, and then plus with the heart block, it's not beating as efficiently or effectively. So that can be dangerous. In those cases, the patient might need pacemakers, either permanent or temporary. And in the next video, we're going to go over pacemakers. This is not a pacemaker, but you can look at it for a second, see if you can figure out what looks off about it. The next video, it's going to be kind of a catch-all. We're going to go over what this is, as well as a few other things, including pacemakers briefly, although it's not like a pacemaker class, and just kind of some general things about all that. So yeah, see you in the next video.